Hi friends, I am Dr. Sumana, Professor of Clinical Microbiology at JSS Medical College and Hospital, JSS Academy of Higher Education and Research, Mysore. I'll be presenting to you a series of videos on antimicrobial stewardship. But before we move on to stewardship, we should know the global burden of antimicrobial resistance. Then you will understand why stewardship is so important. In the year 2019, AMR resulted in 0.7 million deaths across the globe. And if it's not controlled, it is estimated that AMR is going to claim more than 10 billion lives, which will be more than the cancer deaths. So if we do not act now, we're going to lose out the battle against microbes. In 2019, 1 in 5 people who died due to AMR were children under the age of 5, which shows that AMR is not just a problem of adults, it's a problem of children too. And a study in the US shows that more than 80% of the antimicrobials are used are for the livestock and less than 20% are used for humans. So both the clinicians or healthcare workers and animal husbandry workers should restrict the use of antimicrobials to reduce the antimicrobial resistance. This is called the One Health approach. Here I've developed an animation for you. Here a healthcare worker is trying to pull up the good health. Along with that, she can pull up the economic growth, no hunger and no poverty goals. But AMR is going to swallow the good health and all other sustainable development goals. So AMR is not only going to swallow the good health, it can swallow the economic growth, the no poverty goal, and the no hunger goal. Another animation which shows antimicrobials have pulled up the good health, along with that other sustainable development goals, but AMR is going to pull them all down. Here you can see that AMR is burning a big hole in the economy of any particular country. WHO has classified antimicrobials into 3 groups. It's called AWARE group. A refers to access, W refers to watch, RE refers to the reserve group of antibiotics. More than 60% of the antimicrobials that we use should be from the access group, and about 20 to 30% from the watch group, and less than 10% from reserve group. Using antimicrobials from access and watch group, there's a lower resistance potential, while use of antimicrobials from reserve group results in higher resistance potential. So these are the 3 groups of antimicrobials. The current situation is lower percentage of antimicrobials used are from the access and the watch group, and higher percentage from the reserve group, especially in the low and middle income countries. The goal of the stewardship is to reduce the use of watch and reserve group of drugs and increase the use of access group like this. So this decreases the cost for the patient, reduces the hospital stay, and reduces antimicrobial resistance. It also improves the patient outcome and patient safety. Now, as per this diagram, which is called the rule of 30, 30% of the patients in the hospital are prescribed unnecessary antibiotics, and 30% of them are inappropriate, and 30% of the surgical prophylaxis is unnecessary. But in the low and middle income country, this 30 can go up to 40 and 50. When we look at the cost of the pharmacy, the cost for antimicrobials is about 30%, and all other drugs is about 70%. The goal of the stewardship is to reduce this 30% to less than 10%. Now, by unnecessary use of antimicrobials, what can happen? So, this depicts the normal gut flora called the healthy flora, which is called eubiosis. When antimicrobials are ingested, there is altered flora in the gut. So, the green healthy bacteria replaced by unhealthy red bacteria, and this results in altered metabolism of the gut, excessive absorption of the fat and fat deposition, resulting in obesity. As a consequence of obesity, you have diabetes, hypertension, and cardiovascular diseases, etc. It also results in allergic disorders and inflammatory bowel diseases. These are some of the drivers of antimicrobial resistance. One is overprescription of antibiotics, lack of new antibiotics. No newer antibiotics are coming into the market because it involves billions of dollars to bring it to commercial use. Infectious diseases lack rapid laboratory tests, and then poor infection control practices in the hospital and other healthcare facilities, poor hand hygiene and sanitary practices, and patients not taking the antimicrobials as per the prescription. So please do not share antibiotics with others or save for posterity. Once you're prescribed the antibiotic, take the complete course. And when you don't complete the course, it increases the antimicrobial resistance, leading to more cost, longer hospital stay, and even death. Antimicrobial resistance can also happen due to falsified antibiotics. By stewardship, we ensure better patient outcome, reduced adverse drug reactions due to antimicrobials, reduced hospital stay, reduced cost of treatment, reduced incidence of antimicrobial resistance, and saving antimicrobials for posterity. Friends, thanks for watching the video. In the upcoming videos, I'll be covering respiratory tract infections, gastroenteritis, urinary tract infections, acute febrile illness, sepsis, intra-abdominal infections, CNS infections, sexually transmitted infections, and other topics would be suspecting different infections and drug resistance in different clinical scenarios, use of colistin along with other antimicrobials, treatment of carbapenem resistant Acinetobacter baumannii infections and other infections, PK/PD of various antimicrobials, intrinsic resistance, treatment strategies based on the culture reports, and common drug toxicities. So please like, share, and subscribe to my channel. So it's in your hand to choose between drug and the bug. So don't let humanity lose out to the bugs. So uphold the drugs, prevent antimicrobial resistance, and try to win the war against the bugs. Thank you.